Hey, I'm Gabe, and I will be your radiographer today, and I will be assisting the radiologist on your UGI exam on your stomach today. Can I get your name and date of birth? Is there any chance you could be pregnant? Alright, before I ask you the rest of the prep questions, I'm going to need you to change in this gown and remove everything, including any artifact or body piercing that you may have. Do you have high blood pressure? Any history of cancer? Any surgeries to your stomach area? Did you not eat anything after midnight last night? Did you eat, drink, smoke, chew gum past 8 to 9 hours prior to this procedure? Have you been experiencing abdominal pain, nausea, vomiting, or heartburn? Alright. So we're going to first start the examination with you standing to take some spot images. You will have to drink some different types of contrast, called the carbon dioxide crystals and the thick and the thin barium. First off though, we're going to give you the carbon dioxide crystals mixed with a small amount of water. And it's kind of like an Alka-Seltzer, kind of like dumping Pop Rocks in some water. And water is what it looks like. And as soon as I open the crystals, I'm going to dump them in the cup that has the water, and I'm going to swirl it twice. And I'm going to give it to you to drink. And don't look at it or anything. Just go ahead and drink it. You may feel like you need to burp, but I'm going to need to ask you to please refrain from doing that. After that, I'm going to give you the thick barium, and it's like a chalky milkshake. It does have a bitter taste. I'm not going to lie, it's not the best thing in the world, but most patients do tolerate it fairly well. And I've had to taste it before, and it wasn't that bad for real. After that, I'm going to give you the thin barium to drink, and it's less dense than the thick for sure. But it does have a similar texture to it, and it's a little bit more flavorful than the thick. You're going to take the cups that have the barium, and you're going to drink it at the request of the radiologist. The radiologist may also have you take a barium tablet, which is just the barium in pill form. The radiologist is going to move you into different positions on the table to see how the contrast reacts with your stomach. And when the radiologist finishes that part of the exam, then I'm going to take our other x-ray machine and take some more images of your stomach. Do you have any questions? Alright, you are going to want to increase your fluid intake. You can eat if you're hungry. You won't have to not do that. You are probably going to experience some white stool for sure, but that's totally normal. And you're going to want to take a laxative if you become constipated or struggle going to the bathroom or haven't had a bowel movement in 48 hours. And if anything out of the ordinary occurs, please contact your doctor.